Okay, we are here today. I have Beth Bailey. She is the Project Director of Rural Health Opioid Program at Community Connections here locally, and Lisa Jones, who is the CEO of Southern Highlands, and they are both involved in the field of social work. So we're going to talk to them today, and I'm just going to ask them a few questions about their line of work, and they're going to give us a little bit more detail. So thank you both for joining me today and for talking with our students. And I'm going to just ask you a few little questions, such as, tell us, as a social worker in your line of work, what does a typical day look like for you? And I know that no day is typical, but just explain to our students what you do on a daily basis, basically.
Beth, you want to take that one?
I'll go first, and then you can tell them what it looks like from your level. So now that I've been in the field for 20 years, now it looks like lots of meetings, lots of program development, lots of coordinating with folks, and then going out in the field to meet with our partners. So earlier in my career, when I was doing direct service, my day would look just like helping people all day for whatever population we were helping. So my work has always been primarily in substance abuse or in medical social work. So it would just be taking care of the consumers or the patients that were mine to take care of that day.
And for me, like Beth said early on, I was started as a case manager actually here at Southern Highlands a few years ago. And so I worked with IDD, or population with mental retardation and developmental disabilities. And so I help those folks on a day-to-day basis with things that they might need, like going to the grocery store or going to a doctor's appointment or something like that. And then I became a social worker for the IDD population with a different company, but my goal was to make sure that those folks had a good quality of life and they lived in group homes or apartments. And so our philosophy was to help people live the kind of life that we would want to live. So they got to go to the grocery store and go to the movies and participate in their own life. But now my role is administrative, pretty much. So I oversee 3 counties with the day-to-day for running a mental health center, but mostly involved with policy development and partner coordination across the counties and across the state. And so that's why I work so closely with Community Connections. And Beth.
Great. You, I think, both have very important roles in our community. What led you to this career path? If you want to describe what, like, did you always know you wanted to be in this field or have other stepping stones along the way?
Well, I always wanted to be a psychologist or to go into psychology. And I realized when I was in college that there wasn't a lot of jobs available for bachelor level psychology folks. And I didn't know if I wanted to go to school right away to get a master's degree. So midway through, about the beginning of my junior year, I added a second major and added social work. And so the two really kind of go hand in hand.
Absolutely. Beth, did you want to add anything?
Well, I always knew I wanted to do something in the helping profession. So the things I probably thought about in high school were being a nurse or a teacher. And once I got to college, I don't really like blood and guts. And I started out as an education major and figured out pretty quickly I didn't want to be a teacher. So that's why I have a lot of appreciation for people who are. And so this, my first placement in college in a school, which is where the college I went to helped teachers learn whether or not they wanted to be in a school quickly. So the child that I was supposed to be helping, I didn't help her learn to read at all. But I found out a lot about her family life and other things she needed help with. So it seemed like I was probably going to be a better fit for that world. So that's how I ended up in social work.
I think as a social worker, you probably have to have that quality of compassion. And I think both of you all have that personality of helping others and compassionate towards others. What about schooling and background? So if we have students that are interested, they say, yeah, I'm interested in the social work field. What do they need to do as far as, making decisions about school?
Beth, you want to go?
I can. To enter the field, you're going to need a bachelor's degree, and I would encourage you just to get a bachelor's degree in social work. That would be the easiest. That isn't what I did, so I had to do some work to work on my licensure to be allowed to practice. So you can do that at Concord. That's what's really cool. We have local programs where you can do that. You can do it at lots of bigger colleges if that's not where, if you don't want to stay around home and go to school. So that's a 4-year degree. And then if you want to continue in the field and you want to do more clinical work or have the opportunity for more promotions, then you can get your master's degree in social work, and you can keep going from there. Is there anything you wanted to say, Lisa?
Well, there's lots of opportunities for internships. So and it's required for the social work field. So you'll do a semester of an internship. So make sure that you pick something that really interests you, and just go learn about it and have fun with it. Like, life's too short to do things that you don't love every day. So just don't pick something because you think you're going to make a lot of money, because you will not make a lot of money as a social worker. It won't happen, but you can have the opportunity to help a lot of people. And so if that's where your heart is, then do the things that makes you happy.
What do you think you would tell students is one of the most challenging things about your work, your line of work?
You can't save everybody. That's very frustrating. Like, in my line of work, we work with folks with substance use disorder. It's a big thing right now because of the drug epidemic, and we see a lot of people die. And those are folks that we've all tried to help in some capacity or another. And the first time that it happened, I was just devastated and distraught. And I still am. I mean, every time that happens, you lose somebody. It's very devastating. But I think you have to realize that you're working for a greater goal. And so you help as many folks as you can, but you cannot save the world.
Right. What about, Beth? Tell us something like a rewarding aspect of your line of work, like something positive for students.
When I go about my work every day, I try to remember that I'm trying to do good work, and I can't be attached to the outcome. I have to believe that if I consistently do good work, the outcome takes care of itself. So some of what Lisa was talking about. But when you see people get it, it's really cool. So yeah. I have peers in the field now who were people that I helped, and that's a pretty cool thing to see somebody walk through active addiction and recovery, get an education, and get to work in the same field to help people. So those moments do come. You just can't get up and do your work every day thinking you're going to see an instant outcome.
Right.
Like we both work with a guy now, and 5 years ago he was in jail and had major addiction issues. And if you fast forward to now, he's clean. He's been clean for about 4.5 years, and he runs his own program and helps other people. And that is why we do what we do.
Absolutely. That would be very rewarding to see that. Give our high school students some advice today, whether it's, if they wanted to pursue this line of work, or maybe just advice in general for high school and then thinking about a career.
Well, if I could give them one piece of advice, it would be do not lose yourself in social media. It's not the end all be all, and don't let the world define you using those guidelines. And I would take time every day to remove yourself from that and to spend time with your family and with your friends and learn how to communicate like face to face, not just through a text message.
That's great advice, I think. Beth, anything you want to add?
Well, all Lisa said, plus I would tell people if you're thinking about your career and how you're going to take care of yourself and maybe contribute to the world for the rest of your life, because you're going to work for years. You know, you're going to work for years and years of your life. And I would tell you to diversify your skill set. So probably the happiest people that I know, regardless of their profession, have something else that they do, and it may make them money and it may not, but they have lots of skills and they've worked on lots of different things. So even if you are a teacher, sometimes teachers have side jobs, sometimes teachers just have side interests. So don't let your work become your whole life, and have other ways that you can contribute and support yourself.
Yeah, and get a basic level job. Like while you're in school, go learn how to wait tables, go work at Berkshire's, learn how to interact with the public, because those basic skills you're going to use every day for the rest of your life. So
Absolutely. I think we've learned a lot today. We've had some great advice from Beth Bailey and Lisa Jones, and I want to thank you both for your hard work in our community and all that you do, and we appreciate you for taking time to talk with our students today.
well, thanks for having us.
Thank you, Jenny.
Thank you.